Hola! In early 20th century, polio was one of the most feared diseases in industrialized countries, paralyzing hundreds and thousands of children every year. Soon after the introduction of vaccine in 1950, the cases started to drop. Global Polio Eradication Initiative in 1988 has wiped out wild polio type 2 and 3 from nearly all around the world. Only wild poliovirus type 1 remains endemic in Afghanistan and Pakistan. Polio is a highly contagious disease that mainly attacks the nerves in the spinal cord or brainstem. It usually affects children under 4 years. Every 1 in 200 infections lead to irreversible paralysis. Poliovirus is a type of enterovirus that spreads from person to person through contact with feces or respiratory droplets, coughing or sneezing. It also spreads through contaminated food or water. The symptoms can manifest itself in four forms: abortive poliomyelitis causing flu-like symptoms lasting 2 to 3 days. Non-paralytic polio may result in generalized body stiffness with severe headache. Paralytic polio causes intense pain, extreme sensitivity to touch, tingling or prickling sensation, muscle spasms or twitching, muscle weakness leading to limb paralysis. Common signs and symptoms of post-polio syndrome include progressive muscle or joint weakness and pain, fatigue, muscle wasting, breathing or swallowing problems, sleep apnea, low tolerance of cold temperatures. Diagnosis is usually clinical or by testing body fluids. There is no cure for polio. It can only be prevented. There are two vaccines available: oral polio vaccine and inactivated polio vaccine. Because of them, 20 million people are able to walk today who otherwise have been paralyzed. Preventive tips are: wash your hands thoroughly with soap and water after going to the bathroom. Avoid drinking contaminated water or getting it in your mouth. Avoid swimming in contaminated water. Don't eat foods that have touched contaminated water. Staying away from polio infected person, and don't touch contaminated surfaces. Keep in mind, you are at high risk if you live in or travel to an area where polio still spreads. Take loads of care and keep all the sick patients in your prayers.